An abandoned asylum, terrifying monsters, and believe me when I say you do not want this doctor as your primary. Today, we are breaking down and reacting to all of the horrifying medical scenes and survival injuries from Outlast. Let's dive right in. Oh, I gotta comment on the anatomy. You're seeing all the ribs, you're seeing muscle. It almost looks like there's no skin, or the person's so dehydrated that you're able to see everything through that. Why is this doctor shirtless and almost looks possessed and sick himself? I would never go into a hospital shirtless. Like, come on. Come on! Oh! The elevator shaft crushed that thing in the mid-abdomen, kind of lower chest area. What actually happens with that? Rib fractures, obviously, if the area is low enough, so you can snap some ribs, and if the ribs snap, it causes a lot of pain. And unfortunately, when people fracture ribs, there's really not much that we can do at the hospital. They kind of need to heal on their own, unless they're so destroyed. Then there's an evaluation by an orthopedic surgeon. What? Holy cow. Holy cow. Just impaled right through the abdomen, still alive and moving, which is actually more realistic because you're not going to die right away. If it's just punctured through the intestines, it's just going to slowly bleed, especially since you haven't removed the impaled object, and increasing your risk of infection. You could probably be there for at least a couple days. Holy cow. This looks like the old device that they would use in like medieval times, but using almost like a hatchet slash axe onto the anterior chest wall, which again, causing some lacerations, blunt trauma to the chest. You can cause pulmonary contusions or lung bruises. When you have a bruise to your lung, it actually decreases the ability to oxygenate blood flowing through because there's not a normal exchange of gas to the blood. Then obviously you can have a lung collapse and then multiple rib fractures. Whoa! Is that like a pickaxe? Oh! Wow! I didn't see that coming. I did not see that coming! Large, long spear, left side of the chest, could hit the heart, could just go straight through the lung. The heart is a central structure. It changes position as we breathe, as our diaphragm is moving up and down. If you're in that moment of an exhale, get that type of piercing wound, then there's a chance that you can potentially hit that left ventricle, which is like where the money is. That's the money shot, basically. What? Come on. Come on. This isn't a video game? So you're lacerating your neck all the way across. Please, nobody do this. Carotid arteries and jugular vein are on either side of the neck here, underneath the major muscles. Midline is your trachea and your esophagus. The blood's gonna pool out, not squirt out with every heartbeat. Oh, fall from 1 story up, but it was probably about the height of 10 to 20 feet or so. Unless you land directly on your neck, you're gonna have some blunt trauma, but it shouldn't cause major issues, even though anybody falling from that height, we do treat as major trauma because there is the possibility of a lot of injuries, but immediate death, you unfortunately just have to land in that perfect spot. Little pig. Whoa. Versus that kind of fall, which seems a lot higher and probably killed us as a player. What was up with that guy's teeth? He almost looks like a scary clown. These growths on his back, or is it just massive trapezius muscles? The trapezius muscles are those lumps here on the neck where like some of the weightlifters that we see out there just like jacked. You know, like, where's the neck at? It's because the trapezius muscles are so well developed. Computer. Oh, a syringe. What are they doing there? That needle looked really long. Everybody freaks out with a long needle, but it's actually the wider the diameter, that actually is more scary. It has to do with more discomfort because of the wideness. Sometimes we'll do needle aspirations of like an abscess in a tonsil, and it's easier to use a long spinal needle. That way we're not sticking a huge syringe in somebody's mouth. Same with when we do a lumbar punctures, aka spinal taps. So
I didn't want to have to do this.
So check out that syringe. It's got the thumb holes and finger holes. That is more commonly used at the dental office or oral surgeon's office because of the ability to hold it in one hand. We typically do not use these in the emergency departments. This one you would re-sterilize versus we have all disposable tools in the emergency department. I've used this every now and then. It does make life a lot easier, but you can get done 99% of everything I need to get done in the emergency department with a normal syringe, normal plunger versus one like this.
There is so much yet for you to witness.
Whoa, creeper.
Where'd you get those peoples?
Obviously, if he wants him to witness more, it's probably a sedative of some sort. In the emergency department, we do use sedatives for multiple different reasons. For conscious sedation, aka sedatives, or even anxiolytics, so anti-anxieties, or for people who need to calm down. Versus here, probably using something quite off-label. Fire! Whoa, exploded fire. Fire running past, you gotta be really careful. Sometimes you can cover yourself with a blanket or a fire blanket or something like that, but you're always worried about breathing in the fumes and the flames, so you can burn your own airway. So you have to be really careful. House fires, there's potential for a lot of cyanide due to different plastics that are around, and then obviously any superficial burns to tissue. Oh!
You paying attention?
Wow. I'm assuming he cut off of a finger. Remember, if you lose a digit, grab that thing, wrap it in like a wet gauze, put the wet gauze maybe in a bag with the finger in it with ice, maybe ice water. You don't want it to get freezer burn, but you want to cool it down. You want to stop the bleeding on your own finger, get to the hospital ASAP. And then he smacks him in the face. Actually quite good from a gaming standpoint. He cut his finger off, and we as the gamer got like blurry, lightheaded, had this like weird feeling, which happens. You get lightheaded, you get dizzy, you feel like you're gonna pass out. The medical term for passing out is syncope. This would be described as a near syncopal episode where you're almost about to pass out because you're in so much pain. So it's quite common.
There's a lot for you to absorb.
He's cutting all his fingers off? Oh, he did! Holy cow.
I don't believe that man's ever been to medical school.
So he's missing his index finger on the right, he's missing his ring finger on the left. And actually, it looks like the index finger on the right, you can actually see the bone. So sometimes when you have an amputation, by whatever means, the bone actually is sticking out further than the tissue. How are you gonna close that up, right? So you actually have to use something called a ronger, where you basically are cutting the bone back down, so that way you have tissue to cover over top of that area, especially if you can't reattach it. That was really interesting. I wanna see more clips of this. Very cool, the anatomy is really cool. I bet there's more instances in this game. Outlast. If you guys enjoyed this, definitely check out this playlist right here. And as always, do me a favor, make sure you subscribe, turn those bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.